Every nation in the UK is in a form of lockdown, and this time there's no novelty factor. We know how damaging it is to our children, our economy and our mental health, particularly the poorest. The one point of light in the gloom is that surely this must be the last one, now that we have vaccines available. We'll look at how quickly those vaccines can be rolled out and what this third lockdown means for schools, for exams and for business, as well as hopefully offering some practical tips to get you through it, including if you have young children. But let's turn first to the reason we're doing this, to support our overburdened hospitals. And yesterday, the NHS was moved to alert level 5, which means there is now a material risk of the NHS in several areas being overwhelmed over the next 21 days. Katherine Henderson is president of the Royal College of Emergency Medicine. She's also a consultant at St Thomas's Hospital in London. Good afternoon.
Good afternoon.
Now, that moving to alert level 5, a risk of the NHS being overwhelmed, that came obviously yesterday, shortly before we learnt we were going into lockdown. Does that then remain the case today? How quickly are you able to say that the lockdown has saved the NHS?
We'll need to wait several days, if not a couple of weeks, to see a plateauing and then hopefully a reduction in attendances to hospital. The problem is that when we have these very high rates of infection, we know that there is a delay to when patients start coming into hospital, and then sadly a delay to when we have deaths. So it's going to take us a bit of time through probably to the rest of January to see that the lockdown is having the effect that it absolutely must have. And so while we are, pleased to be in the situation of that's the plan, we know that the next few weeks are going to be extremely difficult.
Well, we saw the infection rates just soaring over the last few days. Those presumably mean hospitalisations baked in. Is it only going to get worse in the next 3 weeks?
So that's exactly the point. We've got very high levels of community transmission. We need to break those chains of transmission. We need to have enough staff to be able to manage the patients that come from those baked-in infections, and that in itself is problematic. And so we need a period of stabilisation to see that we can manage the patients who are coming through the door, make sure that we've got the facilities that those patients need, are able to carry on the emergency care of other patients who've got non-COVID acute problems, who we desperately want to have the confidence to keep coming to hospital and not drop away in the way they did in the first wave. So it's trying to get a balance so that we can treat all the patients that need care at the moment.
OK, but so what goes? What is the NHS not able to do now?
Well, there are going to be difficult decisions in organisations, which obviously is not my field, but around elective care. They're going to have to look at what is prioritised, at what is done, where staff can be moved to support the front end. There are going to be consequences of having very high community transmission rates. It's not an and either or. We have to focus on the emergency cases that are physically in front of you before you can do the other stuff that is still needed to be done. So it's the unintended consequences of high community transmission that is so difficult.
Just briefly, do you fear that there are parts of the NHS that just won't be able to cope in the next couple of weeks?
I think we will cope because we always do, and because everything is put forward to make sure it does cope. So I think we will cope, but we're coping on the background of a fairly tired staff, and there will be unintended harms of patients that we don't see the harm that they're coming to, and that the public maybe don't see the harm that they're coming to because of us not being able to do everything that we would have wanted to be able to do.
Katherine Henderson of the Royal College of Emergency Medicine, thank you. Well, the announcements yesterday raised many questions.